rehabilitation, physical therapy, and occupational therapy. And leading that session today is Dr. Amy Kanallakan. How'd I do? Yay. We just met in person this morning, so we're trying to figure out each other's last names. She is an assistant professor in the Physical Medicine and Rehabilitation Center at Children's Hospital here, and with her are Leanna Linzel, who is an occupational therapist, and Emily Santos, who's a physical therapist. We're actually going to be bringing the teens and the kids back into this session for all of you to be together, and then we're going to take a break, and after the break, we go back to the breakout sessions again for the adults, the teens, and the kids. So if you can help us at 11:30 kind of direct your kids in the right direction, we'd appreciate it. Thank you.
Sounds good. Thank you, Cindy. Okay, absolutely. Okay, perfect. Can you all hear me in the back? Am I loud enough? Okay. Thank you all for including us in on today's discussion. I think as rehab professionals here, our goal is to work with kids and families on you have scleroderma or various different types, and it affects everyone's body and function in different ways. And so this is where what we'll be talking about today is some of the ways that looking at function and looking at ways that rehab professionals could help or assist with improving your day-to-day activities, endurance, et cetera, could be helpful. So thank you for having us. As a rehab physician, I'm kind of one of those doctors. A lot of people don't really know what I do, but we wear different hats in the hospital and in clinic. But our focus, regardless of whatever a child is living with, is to look at how does it impact your day-to-day life. So how does it impact how you move, which can be endurance. It can be how much energy you have to walk around Disneyland on a given day. Your activities of daily living. So these are those things like eating, getting dressed, brushing your teeth even, showering, putting on makeup if you have some issues with your hands or fine motor skills. For kids, what's a kid's job? A kid's job is to learn and to play. And so how does your medical condition affect your participation in play? Also school participation. And so Carrie later on today is going to talk a little more about school. And so I'll leave that to her. I think it's a 1 o'clock discussion on that. Driving, this is something that might terrify parents, and I have a 6-year-old, I'm already scared. But how like holding the steering wheel, how could driving be adapted functionally? Also participation in activities with family and friends, enjoyment of these activities, and even quality of life. What do we look at when we're looking at function for a child? Could therapies be of benefit? So whether it's working with a speech therapist, a physical therapist, or even an occupational therapist. Yeah, and you can feel free to look around and find your bambino. Maybe they're all stretched out after being in yoga. Also, would orthotics be helpful for either improved positioning of your hands, your feet, or would equipment be useful? School accommodations, driving adaptations, or even adaptive recreation. And so looking at participation in community activities and a child of all abilities being involved in those. And so what I'm going to do next is I'll introduce Emily Santos. So she's one of our physical therapists here at Children's Hospital Colorado, a pediatric PT who specializes in treatment of all kinds of different orthopedic type issues as well as physical impairments, does a lot of work with serial casting as well as joints, and then overall care for kids with scleroderma. Emily.
Hi, I'm Emily. So what we will be talking about first of all are just the objectives of physical therapy and what we are looking at as physical therapists when we see you. We're going to discuss the physical therapy assessment considerations for scleroderma. So what we're trying to find out when we see you and what impairments you have and how we're going to treat them. And to explain the goals and treatment with children with scleroderma, including home programming, and we do lots of patient education as well. So goals for physical therapy. Oh, I went the wrong way. Sorry. Oh, that's okay. We'll do this one first. We got it. Okay, goals for physical therapy. We really like to try to make them patient-driven or kid-driven. What do they want to get back to? Do they want to get back to riding a bike? Do they want to get back to playing with friends on the playground? Really, our goals are not as important as theirs. We can incorporate all sorts of things to get them back to what they want to be able to do. So we definitely work on patient and family education, including joint protection, pacing, community resources, different groups or activities they would like to join. Increasing and maintaining joint range, stability, and muscle strength is really important. Postural re-education, getting them in a posture where they're not going to develop pain or develop further contractures. Increasing functional mobility independence, getting them to be as independent with what they want to do so they can participate in activities with their family, friends, in school, and in the community and at home. Pain control is really important. That's probably what we focus on first. Pain affects so many other things, so we really try to get that controlled in order to develop all the other skills. And home programming as well. It's very important. Oh, thanks. Oh, no, you're fine. Perfect. You're fine. So assessment, or what we do during a physical therapy evaluation, or what we look at. Posture is very important. A lot of times with skin tightness, you'll see, a forward head positioning, protracted shoulders or rounded shoulders, and kind of this kyphotic or rounded position of the spine. It's really important to work on that so they didn't develop further impairments there and can do all their fun stuff that they want to do. Range of motion. A lot of times you'll see tightness in calf musculature, causing walking problems, gait problems, sometimes toe walking if it's severe enough, and also it can develop into falls too if they're not able to clear their feet. So we look at all that as well. Muscle strength. A lot of times you'll see decrease in core and proximal hip muscles, or a lot of the muscles around the hip. Sometimes if you don't have the activity tolerance to do the things you want to do, this will lead to weakness in these muscles. Functional mobility independence. What do you want to be able to do, and do you want to be able to do it with less assistance or less help with things? That's important as well, just to give kiddos independence with what they want to be able to do. Balance and coordination. Can they stand on one leg to throw a ball if they want to do that on the playground? Can they maneuver around the playground to do the things they want to do? Do they have the balance and coordination to participate in activities with friends? Endurance, like I said, is an important one too, just to be able to tolerate activities with your family and friends and not have to rest. So we kind of look at activity tolerance as well. And then, like I said, pain is usually one of our first ones to address because it affects all else. We do a lot of outcome measures because you do want to know, do you feel like you're getting better from the beginning of physical therapy to the end? We do a lot of outcome measures. So when you first come to physical therapy, we'll do some functional measures, and then throughout the time of physical therapy, we'll do them well. Just because I think sometimes kids, it's hard for them to tell if they're getting better or not. But if we can say, hey, you walked 6 minutes in this amount of time, but at the very end you doubled your steps in that amount of time, that really gives them something functional that they can see and how they improved. Interventions are things that we do in physical therapy to help these impairments that we just talked about. Exercise, we do this with 100% of our kiddos that come to physical therapy. Regular exercise is super important for maintaining skin integrity, joint flexibility, improved circulation, and prevention of further contractures or joint restrictions. Stretching, super important as well. We do a lot of active and passive stretching. So active would be you actually stretching your own muscles. Passive would be your parents, family, friends, therapist helping you stretch these muscles. Important for maintaining range of motion and prevention of contractures. Some common contractures or joint restrictions we see in the legs: hip flexors, these muscles right in front of your hips. Sometimes if these are tight or you do a lot of sitting or not able to get up as well, these muscles get really tight and can lead to more of a forward hip positioning there. Gastrocnemius and soleus muscles are your calf muscles, two of your calf muscles. If those are tight, a lot of times, like I said, you can lead to toe walking. Not being able to clear your feet when you walk can lead to falls. So those are really important to stretch as well. Hamstrings, the muscles on the back of your thighs, those are important to stretch as well. If those are tight, they can lead to kind of a decrease in knee extension or straightening, so can lead to not being able to stand up properly as well. And then quadriceps, the muscles on the front of your thigh, if those are tight, those can lead to knee pain, patellofemoral or knee problems there as well. Physical therapists can definitely individualize the program. Not everyone needs the same stretches or the same home program. So we can really individualize stretching programs to meet kids' needs to work on optimal muscle lengthening. A lot of younger kids too, if you tell them to do a stretch, it's not going to be, they're not going to be that excited about just standing there for 5 minutes. So we really try to use functional play, yoga, things like that into stretching as well to make it fun for kids. Wound management, as you heard previously, there's an altered skin integrity, a lot of times at upper and lower extremities, hands and feet. So we really try to make sure skin integrity looks good there, and we can always do wound management for that, and to keep your hands and feet warm for increased circulation. Joint protection. We do a lot of education just in minimizing stress, pressure on joints. If we notice people have a lot of knee hypermobility or stand in kind of a hyperextended position and have knee pain, we can really talk a lot about really focusing on kind of more mid-range activities and getting kids more aware of the things that aggravate their symptoms as well. And then also splinting, as you've heard previously before, is really important for optimal joint positioning as well. And Leanna, our occupational therapist, is going to talk more about that as well. Orthotic management, we do a lot at Children's Hospital here. We have a whole foot management team here. A lot of times, kids, you'll notice they have more of a pronated, turned-in foot, their heel's not in an optimal position, or if they don't have the range of motion at their calves, can't even get their feet down on the ground sometimes. So orthotic management really offers support with functional activities, will help the feet and the legs not get so tired as quickly as well. Arch supports are really important. We can either fabricate arch supports or really recommend good over-the-counter ones as well. Heel wedges, sometimes if kids don't have the range of motion at their calves and they present with a little bit more toe walking, we put those in shoes as well, just to accommodate for that range of motion restriction, as well as it kind of brings the floor to them so they can get more of a heel-toe gait pattern and not trip as much. Also helps with proprioception as well, just to get pressure through that heel and let them feel that through there. University of California Berkeley braces. These are shoes we make here. I don't know if they make them elsewhere as well, but we make them a lot. It's a little brace we make out of aquaplast. We heat it up and then mold it to the foot. It really tries to get the foot in a neutral position, and then it just slips in the shoe, so you can't see it outside of the shoe. Just slips in the shoe and really helps with getting a more neutral foot position and really protecting that arch as well. Night splinting, so you could do some serial night splinting, which is we cast kids' feet, take it off, and then they wear them at night just to keep that range of motion so they can maintain it and prevent further contracture. They're really pretty comfortable actually and lightweight, and kids can put them on and off by themselves. And then the other thing is serial splinting or casting. Sometimes we will cast kids just to get at their feet and legs, just to get improved foot clearance and motion at that foot. But one thing you really want to be aware of on that is skin integrity issues too. So we would be very careful with that with kids with scleroderma. Last but not least, energy conservation. Kiddos may have decreased energy tolerance or just not be able to keep up with their friends and their family when they get to do fun things. So just kind of a lot of education talking about doing things in moderation, not going out and running a 2-mile race or doing a race with your friends all at once. If you need small breaks, just to take those and to really progress activities slowly as well. Sometimes that will help with fatigue. And Leanna now will go ahead and talk about some of the OT pieces of things.
Good. Leanna Linzel is one of our pediatric occupational therapists here at Children's Hospital Colorado, and she is a hand specialist in addition. And so she is going to talk a little more about some of the occupational therapy management of scleroderma.
All right, so again, my name is Leanna, and I specialize in the hand and upper extremity. So I'll be talking a little bit more about the upper extremities compared to Emily talking a little bit more about the lower extremities. So first I want to touch on what occupational therapy is, because a lot of people have heard about it, but don't really understand what it is exactly that we do or what we are looking at. So occupational therapists help people with various health conditions, including scleroderma, increase their ability to do daily activities that are important to them, much like physical therapy. Or one way to think about it is all the things that occupy your day or occupy your time, which is why we're called occupational therapists. For kids, their primary occupation is play in school, like we talked about before. Also being able to participate in hobbies and sports, activities that are important to you, painting, drawing, all of those types of things. Our goal as occupational therapists is to be able to help you do those things with improved function and independence. We are nationally certified and state licensed therapists that are part of the multidisciplinary team. We work really closely with the doctors, other physical therapists, psychologists, and it does currently require a prescription from your doctor. So we already talked a lot about how scleroderma can affect your function, but these are some of the ways that it can specifically affect your upper extremity function. So again, that swelling and tightness can make it hard to use your hands. Motion can be decreased due to that skin and soft tissue thickening and tightening. Hand contractures can then develop. Joint pain is something that we look closely at. And because you might not be using your hands and arms as much as you normally would because of pain or other limitations, weakness can develop. Also, pain from ulcers on the tips of your fingers can make it hard to do your daily activities, and decreased ability to perform your daily activities as a result of these. So our goals as occupational therapists for scleroderma treatment, much like physical therapy again, is to preserve that range of motion. The first thing that we look at is kind of how much you're able to move, because it gives us an idea of how much function you might be able to have in your upper extremities. Our goal is to prevent contractures from occurring early on, improve strength, and all therefore increasing your function. We might provide some suggestions for adaptive techniques or tools that you might be able to use to do your activities easier. And again, we just want to help decrease pain, improve skin condition, decrease swelling, and help to conserve energy. So if you go to an occupational therapy appointment, you can expect your therapist to ask you a lot of questions about what's easier for you to do right now and what's really challenging for you to do right now, and ask you about what you want to see get easier for you, or what suggestions you might need to be able to do your daily activities with more ease. So they'll probably assess your range of motion using a funny looking thing up there called a goniometer. And they'll check your hands and your wrists and your elbows and your shoulders. They'll also want to check your strength and assess the function of your hands. They might have you do an activity like buttoning or zipping or picking up coins off a table just to see how you're able to use your hands. They'll also want to assess your skin condition, because that can interfere with function if it's a problem. And then they'll want to talk to you specifically about what your goals are for therapy. Like Emily said before, that's most important, is making sure that you're getting what you want out of therapy. But they also may have some goals based on what they know about scleroderma and how it can present in the hands. And they'll probably start with giving you a home exercise program right off the bat. So the first treatment I'm going to talk about is range of motion stretches. So we've touched on this quite a bit already, but doing stretches is really important to help prevent or slow down the development of contractures or stiffness. So if you've already had a contracture starting to develop, it's important to start a program right away to prevent that from getting worse. Or even if you haven't noticed any joint stiffness that's limited your motion yet, you want to start doing exercises before that happens. Doing range of motion stretches can help decrease swelling and pain as well, because when you're doing gentle movement and stretches with your arms, it can help to bring some of that swelling down and therefore decrease some pain by slowly pumping that muscle. And then overall, this helps to improve your hand function. So you want to get started with your regular stretching before your joints get stiff so that you won't lose motion. Once a joint does get stiff, it can be harder to lose, but if you, like I said, if you do have some stiffness already, doing stretches will prevent that from getting worse. You don't want to stretch too hard, like you see Stretch Armstrong being stretched so hard up there. You want to move gently and in a pain-free range of motion. So you don't want to push it too hard, just go within your comfort limits. And also stretching during a time of day that you're most comfortable is best. So if you wake up in the morning and you're really stiff and it's too uncomfortable to stretch then, you might want to do it in a different part of the day. Heat and massage can also help to warm up your tissues before exercise, which we'll talk about later. And then again, it's really important to develop a home program that you can do on a regular basis, every day ideally, to keep those joints and skin moving. So again, it's really important to stretch all of the joints in your arms and upper extremities because we know that they can all get tight. So fingers, thumbs, wrists, forearms, elbows, shoulders. But we do note that there are some specific areas of tightness that get stiff in the hand that you want to pay some close attention to. So I put up a little anatomy picture there of the joints in the hand. The first joint that we start seeing get stiff is that proximal interphalangeal joint. It's highlighted in blue. We call it the PIP joint. It likes to get stuck in kind of a bent position, so we work on maintaining the ability to straighten that joint. The MCP joint, or the one in green there, the one at the back of your hand, that one starts like getting stiff in more of a straight position, so we work really hard on keeping it bent down so that you can grasp objects. And then your thumb also likes to start kind of creeping in towards your hand, so we focus on maintaining the web space or the space between the thumb and the rest of your hand. We call this kind of the safe position with that MCP bent down, the PIP joint straight, and the thumb away from your palm. And if your therapist recommends any type of splinting, it'll probably be in some sort of position like this to help decrease the contractures in those joints. So here are some examples of hand stretches. Your therapist that you see will give you a home program that's designed to you. Like Emily said, everyone's a little bit different, but I just wanted to throw up some pictures of different stretches that you could try at home to get started with, or give you an idea of what to expect from therapy. So we can go through a couple of these together. I know we're getting short on time, but the first one you can do is kind of make a diamond with your fingers and then slowly start pushing your hands together to help open up that thumb and bring it away from your palm. And again, that stops that thumb from creeping in towards your palm, gives a nice stretch to that thumb web space. Yeah, give it a try. The second one shows you bending your thumb down across your palm to keep those thumb joints nice and supple. This third one is kind of like a quacking duck position, and again, it shows that safe position. So it's bringing that big knuckle down and keeping your fingers straight. This next one is showing you spreading your fingers out as wide as you can, like you're gonna go grip a basketball, and that just gives more space in between your fingers. Another good stretch to do is just bring your hands together, interlace your fingers. I don't have a picture of this, but just when you're sitting in class or in a car ride, it's a good stretch. Just keep those fingers open and wide. The last one on here shows you using your other hand to gently push down that big knuckle at the back of your hand here, and that just gives a nice stretch to that MCP joint. These are some more examples on the left side of how to keep those fingers straight, so you can gently push your fingers down onto a table. Again, doing everything gently without increasing any pain, but that can help straighten out that PIP joint that likes to get stuck in a bent position. Pressing your hands together is a good one as well for keeping those fingers straight, or using your other hand to gently stretch each individual finger. On the right there, there's just some more exercises for maintaining shoulder range of motion, reaching overhead, moving your wrist back and forth, and then your forearms. So I wanted to give some suggestions for how you can monitor your motion, because what can happen with scleroderma and other conditions that affect your hand joints is that you can slowly start losing motion over time without really noticing. So it's important to have a couple of ways that you can check your progress over time, especially if you're not seeing a therapist regularly who might be checking your motion. So one idea is to trace your hand on a piece of paper, and that will show how wide you can get your fingers and how straight you can get your fingers. And then you can reference that template regularly just to make sure that you're still able to spread your fingers as wide or straighten your fingers as much. And if you're not able to, then you know you might need to be doing your stretches a little bit more frequently. The next one shows wrapping your hand around a round object, so you could use like a jar of peanut butter or a big mug to monitor how much you can bring that thumb away from your palm. And so again, you can just use that object regularly, make sure you can get that thumb still wrapped around that object. The third one shows the fingers coming down onto an index card and marking how far down your fingers can curl in, just to monitor how much you can bend your fingers. And the last one shows using a template. You can cut it out of cardboard or paper and just put it over your joints to make sure that you can still bend them down as far as that template shows. So we already talked about some different ways to manage renowned symptoms, but I just wanted to touch on a couple here as well. So again, it can be elicited by cold or stress, and it can have a big impact on your hand function. So one idea is to soak hands in warm or hot water, depending on what you can tolerate, for 5 to 10 minutes. You might want to use a glove over your hand so that your skin doesn't get too dry. Layering clothes, like we talked about before, and those high-tech fabrics that retain heat are really great for Raynaud's. Wearing hats and gloves and scarves outside, gloves in areas where there's constant air conditioning, like malls or movie theaters. And then using electric blankets to warm the bed, have someone heat up the car before you get in, all ways to try and keep your whole body warm. Ulcer management. So as we talked about before, you can get those little sores on the tips of your fingers that can make it really hard to do daily activities because it's painful. So I wanted to give some tips and techniques that you can use to decrease that pain and help you be able to do your activities. Up at the top, that's called Coban, and it's a self-adherent bandage that you can put over the sore, maybe with some gauze or padding underneath, to protect it from getting rubbed or bumped when you're doing your daily activities, which can help it heal as well. Using padding on handles and utensils, so using little foam cushions on your pencils. There's other foam handles that I have a picture of later on that can make it more comfortable to press your fingers into. And then using gel pads over sore areas. So these are called, I think it's silo pads, digit caps and sleeves, and they're lined with silicone, or silo pads, that would make more sense. They're lined with silicone, and they give a little padding to your joint as well. Skincare, again, I think we're going to be talking more about this later, so I'll just touch on it. But again, because your sweat glands are affected with scleroderma, it can result in that dry, itchy skin, which again will impact your hand function. So minimizing the exposure to water can be helpful with preventing your skin from getting too dry. Using lotion several times a day, and actually massaging that lotion into your skin, trying to gently move that skin around as you're doing it, can be helpful for preventing stiffness too, because you're going to start mobilizing that skin, which makes it easier to move. Thermal modalities basically refers to the use of hot or cold. Cold, we obviously want to avoid with Raynaud's because it's going to make it worse. It's going to make you flare up, even though in some other conditions people say it helps decrease inflammation. We don't want to use it with Raynaud's, of course. Heat, on the other hand, if it's well tolerated by you, it can be helpful to decrease your stiffness and relax your muscles. So it can be nice to use on your hands or arms before you're doing exercises if you're feeling particularly stiff. But again, water is drying, so you might want to use a thin plastic glove if you're going to soak your hand in water. The picture up here shows paraffin wax bath, which is basically melted wax in a tub that you dip your hand into like 6 to 7 times, wrap a towel in it, and it's nice and warm, and it keeps that heat in your hand. You can vary the temperature based on your tolerance to heat. A lot of therapy offices have this, but you can also get them online to use at home. You just want to make sure you're using it safely and know how to clean it properly. And caution here at the end, if you do notice any increased swelling or inflammation, tightness, or increased pain, then you know it's too hot and you might not be able to tolerate that type of heat. So pay attention to how your body responds to heat. And heat should feel good. If it doesn't feel good, then you know it was too hot. Hand orthoses. So again, the splints or orthoses are used to treat or prevent contractures. They can be custom made or ordered by your occupational therapist. So I have some examples here that can be helpful with scleroderma. The first one here on the left is our little finger splints that were made by a therapist to prevent ulcers. So again, if you're having an ulcer that's having a hard time healing or getting rubbed and bumped, those can be helpful. The second one is a splint that's molded into that safe position. I would personally put that big knuckle down a little bit further in that splint, but that can be something that you can wear at nighttime just to rest in and keep that hand in that safe position. The thumb orthosis there helps keep that thumb away from your palm. And then the last picture isn't exactly an orthosis, it's a compression sleeve, but sometimes people find these comfortable to wear at night because it can help give your skin kind of like a hug, and it can help decrease that swelling and pain. Another caveat to that is with Raynaud's, you have to be careful things aren't too tight. Obviously, we don't want to create any more circulation problems. So finally, I'm going to talk a little bit about assistive devices and activity modifications. So there is a whole world of devices out there that are meant to help people with hand difficulty using their hands do their activities with more ease. So people that have had strokes or scleroderma or all kinds of different reasons that they're having difficulty using their hands can benefit from these types of tools. So the idea is that they just make the task easier for you. There's so many out there that it can be hard to know what's even out there. So I wanted to refer you guys to the Performance Health website, which has a really great layout of different equipment based on the type of thing that you need it for. So whether it's for eating or bathing or dressing, they lay it out by category. So it's a good place to just get ideas from. And then you can go to Amazon or another website to actually purchase it if you find it cheaper elsewhere. But it's a good way to just see what's there. You can also talk to your OT about activities that you're having trouble doing. They can provide some recommendations for you. And then the products that benefit page on the Scleroderma Foundation website is also a great list of tools that you wouldn't necessarily think of that could be helpful for you, especially for people with scleroderma, because it's on their website. So it's a really great resource. Oops, actually, going back. So up in the top right, these are foam handles that you can get relatively inexpensively, and they come in different sizes, so you can slip them on your toothbrush or your pencil or anything else that you might need them for to create a larger grip, and also add some padding onto that handle so it's more comfortable to hold on to. Down at the bottom, we have a button hook and a zipper aid, which is helpful if you have decreased fine motor skills. And on here, we just have a couple more examples. This is a jar bottle opener that makes it easier to hold on to that lid. You have a longer lever arm and a bigger grip that you can use to open it. We think we could all benefit from something like that. We also have a hairdryer holder here, which just stops you from having to use your arms up over your head for long periods of time. Guitar fingers that's what they're actually called, but they could be used for anything to help get a little padding and cushioning in your fingertips for any type of instrument or daily activity you might need it for. And then down at the bottom is a key turner, which again just gives a longer lever arm to make it easier to turn a key if you have trouble with pinch. And I think that's all. Yeah.
I'm going to take this.
Go for it.
We, I think, are moving on to a break. If you guys have questions for our therapists at all, feel free to come down and run whatever you want by them and myself during the break. So thank you, Cindy.
Thank you. Okay, we